All right. We're going to finish up disorders of early childhood. We'll talk a little bit about attachment disorders. These can be very difficult on parent and child. There are a couple of categories of attachment disorders. Reactive attachment disorder, which is a pattern of emotionally withdrawn behavior toward caregivers, generally after a history of extreme insufficient care. So kids have been abandoned, not cared for, not secure. A disinhibited social engagement disorder is a pattern of emotionally disinhibited behavior toward unfamiliar adults after a history of extreme insufficient care. So these are generally associated with insufficient care. Oftentimes, children that come from the foster care system, those sorts of difficult environments can oftentimes have these kind of attachment disorders. The developmental course tends to be ongoing difficulties, physiological, behavior, emotional, cognitive domains, all common in disorders of attachment. These children can improve once they're placed in a caregiving environment for reactive attachment disorders, but not the case for disinhibited social engagement disorder. And so we can see a lot of improvement in reactive attachment disorder, but the dissociative social engagement disorder, much more difficult. Overall etiology is basically related to development attachment patterns. It has to do with early caregiving. What's important is not all children who have suboptimal care will develop these disorders. And so it's not just that suboptimal care. There certainly are other components associated. In terms of assessment and diagnosis, generally involves naturalistic data collection, the stranger situation, some of you might be familiar with, to see how the child reacts when the caregiver comes and goes. The roots of this particular disorder are in early childhood. We tend to start seeing assessment of this disorder sort of in older children and adolescents. And so oftentimes we're trying to close the barn door after the horse got out, so to speak. But this is where we're generally dealing with this particular problem because it shows up in a number of arenas. Best intervention is to prevent these disorders entirely. So this has to do with early education for parents, getting them well cared for. Generally, we want to think about universal prevention measures. So trying to deal with child care, good education, etc. We want to think about some selective intervention for at a sort of above average risk parents, and then indicated measures for groups with specific risk factors that we'll use for different types of prevention. So sometimes this might be, of course, the most extreme would be removing an infant from the home. Other cases are we're trying to get parents into classes, social workers coming over, families involved. So we really want to do our best to try to make sure we prevent this disorder entirely because treatment is difficult. Really, it's going to depend on the degree of the disorder, the particular etiology, the age of the child, and the scope of environmental change involved. So every child's going to be different, of course. Children with reactive attachment disorder generally do quite well once their caregiving has improved, once they're either adoptive or in positive foster placements. Once they're in a good, loving home, they tend to do well. So we want to provide treatment to adolescents who were maltreated as children. Oftentimes, this is going to involve a significant course of therapeutic intervention. Infant-parent psychotherapy is where we're going to bring the infant and child together to try to get this relationship resolved, to try to make sure that the attachment is moving appropriately. It's been demonstrated to be effective for various populations, particularly, again, in infants and maltreating families. So trying to improve this infant-parent attachment early on is going to be our best strategy. So a lot of this is going to involve both systemic change as well as sort of individual parent-child change. All right, that's quick, very quick introduction to early childhood attachment disorders.